Thank you for joining us today for our webinar. My name is Chris Beckwith, and I'm with NextGen Healthcare, and I'll be hosting today and providing any support. Today's topic is smart messaging, your next new hire. Our guest presenting today is Kelly Zielinski. Kelly is a senior business development manager at Doctible. And before we get started, just a couple of housekeeping items. Any questions and comments, you can offer your input or questions to Kelly or myself. In the lower right-hand corner, there's a chat window or a Q&A window. We will have some polling questions popping up throughout the presentation as well, and you can answer those. Those should pop up on your screen, and you can answer there. And then this webinar is being recorded, and we will be sending that out to everyone that registered for the webinar in the next couple days, and we'll send that out. And any information that you need, you can follow up on directly through that email that goes out, or if you have to drop off the webinar, we're happy to make sure that you get a copy as well. So don't worry about that, it will go out. And with that, I think all the ground rules are covered, and Kelly, I'm going to hand it off to you.
Excellent. Thank you so much. It's so good to be with everybody today. We're very excited to share this topic with all of you that are here. Thank you for making the time first and foremost. So is smart messaging your next new hire? We're going to look at this brand new tool from the angle of technology really being an added assist to your practice. And while we certainly aren't saying, this particular module can replace a person, that's not it at all. It just simply is, if you can leverage technology to be more efficient and to free up some time inside of your practice, would that be of benefit to you and your staff? And usually the answer to that is yes. So we'll go through this piece by piece. And, one of the things, like Chris had mentioned, that there's hi on me, is we want this to be interactive. And so please don't feel like you need to hold your questions to the end. I know that's a pretty typical webinar format. We really would like you to ask them as we go along. If it's something that can be directly answered quickly in chat, then we'll go ahead and do that. But if it's something that makes sense to what we're discussing, and maybe there's a point of clarity that you need, or just a little bit more of a deep dive, we'd really like to go ahead and do it at the time. I usually think that's beneficial for all of you, and it helps to be a more engaging experience. So while we will have dedicated time at the end, please don't be shy, ask away, and Chris knows he can interrupt me at any point if there's a relevant question. So with that, let's get into it. So smart messaging, and really the whole point of today, is to talk about how do we get messaging to patients both before and after their appointments. I'm sure we're all familiar with the imagery that you're looking at here in the top section, and I'll explain kind of the parts and pieces. But usually in today's environment, even if you are running automated reminders inside of your practice, those are usually fairly standard, meaning that all of your patients are receiving the same kind of messaging, right? Every appointment's getting a standard cadence of messages. They're going out at a very specific time that you've predetermined. And that's assuming you're using an automated solution already. Potentially you are doing all of this manually, and so there's even more time involved in getting the information to the patients that you need. What we're looking at with smart messaging is, how do we take the information that we know we need to send to patients who are coming in for a certain type of visit, or they're brand new patient, right? That's a very common experience. Hey, I'm brand new to the practice and I'm coming in for my appointment next week. You at your offices know what kinds of information you would typically share with those patients. And right now you're probably sharing it manually, or you're counting on the patient to be proactive and go and find that information on their own. What we're suggesting with smart messaging is that you can leverage technology to get messages out to patients both before and after their appointment that are set up specifically by you based on maybe appointment type or the fact that they're a new patient, and we'll kind of get into some of those variables. But getting those out on a cadence that makes sense for the type of appointment or the type of patient that they are to your practice. And then that frees up the staff, right? Because now we've automated those messages, we've determined what the time frame should be for all those things. So think about this tool as a way to take that communication that you're very likely doing manually right now and automate it to fit the needs of your patient base. So that's what we're going to look at today. Like I said, it's a really robust module, so there's a lot to it. So I'm going to try to break it down as best I can. But if anytime you have questions, feel free to ask away. Okay, and we do have a polling question up. I just see it pop up. How long has your practice used automated patient reminders? This is important, I think, for us all to know, those of you on the call and certainly after the fact, what you're currently doing for that. So please go ahead and answer that poll when you have a minute, and I'll keep going through our agenda. So I do want to talk briefly in the very beginning, and we'll keep this very short, how the pandemic has really changed technology inside of healthcare, because it has really been very transformative. Then we'll go into what is smart messaging. This is where we'll get into the nuts and bolts of how this works. Then we'll look at the product on some slides and give you some very specific examples. Of course, keeping in mind that this is all of healthcare. It makes sense for all of healthcare, no matter your specialty or the type of patient you're working with. And then when we say consultation and extended Q&A, that is just simply to answer more of your questions towards the end. I anticipate we'll be together between 30 and 45 minutes, probably. If we need to go an hour, we absolutely will. The more questions you ask, the longer we'll all be together here today. Okay, so the world has transformed. I know we get this, right? COVID has happened. I would love to say we're out of it, but I don't know is that's completely the case. But what we have seen, and I'm sure a lot of you have experienced it as well inside of your offices, is that the adoption of technology has gone so quickly based on years prior, right? So when the pandemic happened, we all had to look at our solutions inside of our offices and go, does this meet the needs of today's world? And healthcare a little bit had been behind maybe the curve of a lot of business in terms of adopting healthcare as the norm, right? As the normal experience that we would see inside of a practice. So we just know that the pandemic has changed quite a bit of the digital adoption and technology, certainly sped it up very greatly. And then dental and medical practices, right? So these, medical in general, right? This adoption has been about 3 years acceleration. So I think that's interesting data. When you look at that, and in the bulk of the pandemic, we went from, a typical clip of where we would see technology adaptation to an extreme move right up and to the right, which is meaning that patients are just simply expecting more of this type of technology, right? They're expecting a more customized, more simple, more interactive experience with your practice. And and I think there's also been some assumptions about what do we do in healthcare? Maybe we were not moved forward into the digital sort of transformation age. We were still using a lot of paper, doing things very manually, and I do think there was a very clear sentiment a lot of places, right? That, maybe we just don't need to be there yet. We're healthcare, so we do things a little bit differently. But a lot of those assumptions or things that we may have previously thought have been adjusted through the pandemic, and we've seen rapid adaptation. So an outdated assumption, number one, is that customers value the human touch. And I don't think that they don't value it. But what the reality is, and what a lot of studies have shown, is if you can give them a well-organized, very clear and thoughtful and effective digital experience, then that is equivalent to or even better than what we would call the human touch, quote unquote. So if you think of something like a phone call, usually if you talk to most folks, they are not necessarily answering the calls that come to their phone. They might be letting them go to voicemail. Phone calls can seem a little bit labor intensive for a patient, like, I got to call the practice for this, or I got to call the office for that. So really texting and the ability to do things digitally has become the norm, and that is really looked at more of the VIP experience versus being on the phone with somebody, which may have been the norm just even 5-10 years ago. And then regulations. So this is something that I know security is usually forefront on everybody's mind, right? We're healthcare, and so we have to cross our T's and dot our I's, and of course that is still extremely important. But what we have found is that there are HIPAA compliant ways to do a lot of the things that maybe in the past we weren't sure if we could do, or if it would make sense because of some kind of regulatory standard. And so we've again seen adaptation to technology because either those regulations were adapted to the modern age, and or technology has evolved in such a way where we can really do these things safely, securely, and in an easy way for both practice and patient. And then, you know, sometimes we always think it's like the newest iPhone comes out, you know, do you want to be first? Do you want to be second? When we think about adopting, what we don't want to be is last to the table, right? We don't want to be last to the table with adopting new technology. We want to be potentially not necessarily there first, but we want to be there quickly, because as I talked about, expectations are in such a place where if you're not keeping up, you have the potential to fall behind, and fall behind pretty quickly. And so what's really cool, I think, and exciting today is that what you're looking at from smart messaging, this is very new, very innovative technology, and we're so excited to be talking about, you know, what's available now, because this is a newer launch, right, of a product. And so you are here looking at a product from the beginning, which is great. Okay, so poll question might have another one, and I've got that on another screen, so I'm just going to skip through. So smart messaging customized to your practice. I want you to keep this in mind as we are looking at some of these examples, that this can be customized to make sense for whatever kind of practice you are in. If you're in a pediatric practice, we can, you know, you can customize this to work for you. If you're in podiatry, we can customize it to work for you. You know, it is going to work across the board in all of healthcare, because the tool is so broad-based, and we'll get into how that is in just a minute. So if you're seeing examples today that might not be your examples, just know that we want to illuminate what the process would be and what you could do, not necessarily what you have to do and adopt in your office. Okay, so what is smart messaging? So very important key aspects to it. It's an auto send of repetitive messages first and foremost. So we'll give examples in just a bit, but messages that you are currently, whether on the phone or via email or via manual text, if you are currently sending the same types of messages or relaying information, right, to patients of a certain type on a regular basis, then smart messaging is a tool you would very certainly want to consider. Triggered by provider or procedure. So maybe a particular doctor needs specific information to go to their patients because they're treating a certain type of patient in your office. You can set up a smart message cadence to work that way. Or a procedure type. They're coming in for one procedure versus the next, and you want to have certain messaging go to those patients. Or of course, like new patients. So patient status is also something that we can look at as well. So if you are a new patient to the practice, what would it be that you would usually receive before and potentially after your appointment to help make that a smooth experience and to also elevate the quality of care that you're receiving? And these can go, like I just mentioned, before or after. So again, we're usually used to thinking of, you know, reminders or messaging as always being a before the appointment activity. I think that's probably a pretty common idea, but this is before and after, and you'll see this laid out in some of the examples that we're going to give here in just a bit. I do see the other poll question is up, so it's great. What kind of messages are most important? This is an excellent one for sure. So this is a little bit of a reiteration of what we just talked about. So have a specific provider, right? You might want to relay information from a specific provider, a specific type of procedure or status. And then examples here would be 3-day post-appointment reminder after a surgery or something invasive. And then maybe a 2-day pre-appointment reminder for an appointment with a new patient service. So if the patient's coming in and they're having a quote unquote new patient service, like an exam, initial exam or something to that effect, or just a consultation, you might want to have certain things go to that person prior to or post their appointment. And so when you're thinking about this, right, like let's say hypothetically, you're sitting here listening to this and you're like, this is a pretty cool idea. I could probably use something like this in our practice. How in the world would I get started with this? There are 500 reasons I would want to send a message to patients. I very much understand that, right? Because it's a very powerful product. You might be thinking, where do you start? What I think is a really good way to start thinking about this and the practicality of it for your office is to answer these kinds of questions, right? And maybe start with your top 5, top 10 type of repetitive messages that you're currently delivering in a more manual way. So you think through, you know, who would you want to send this message to? We keep talking about new patients or someone coming in for a particular type of procedure. So let's just use new patients, right? I've got a new patient. So I have a message I want to get to my new patients. What do you want it to say? I want it to give them information about our practice because we have weird parking out front. Everybody gets lost and they don't know where to go. So I want to clarify the parking situation to all of my new patients. When do you want to send it? Well, probably the most practical time to do that would be the day before, because that just seems to make sense for us. How do you want it to be sent? That's not something that's mission critical, but it's a nice thing to have. So let's just send it via text. And then why do you want to send this? This is important, right? Because you want to know why you're sending some of this messaging. Not because we're looking at overlapping and things like that, but what's the outcome that you want from these messages? That is important because it may help you consider setting up other messages along the same lines or in the same cadence that makes sense based on this particular one. So, and then again, is it all appointments, some appointments, as a supplement, or independently? So those are also things to think through as well. So let's look at these three ideas, right? Pediatric post-care guidance, telehealth onboarding process, and a message change for a new baby. So in pediatric post-care guidance, the WHO is patients with an appointment type of the 3 to 5 day newborn checkup. Maybe that's called something different in your system, but as a parent, I can tell you I remember that appointment. It's like your first visit with your pediatrician right after you have your baby. And you are usually, right, as that patient, significantly overwhelmed with the fact that you have a newborn. So you're there, all you want the doctor really to tell you is, hey, baby looks healthy, everything is great, go back home, rest up, everything is great. And so when we look at the what, we're looking at the guidance of the first year appointment schedule. We want to give this new patient, parents, right? We want to give the parents of this new baby guidance on what to expect for the first year of their appointment schedules. Because they're brand new parents, they got this new baby, even if they have siblings at home, it might have been a little while since they've been to the doctor. And usually if we talk about this with them in our office, it's like going right over their head because again, they have a brand new baby and it's 3 to 5 days since they've been potentially brand new parents. So we want to send this to them a day after their appointment, in addition to the normal reminders, etc. And we want to do it via text and email so that they can reference back to it in the future. So again, something important to consider, like this is a very good example of a message that would go after the fact to a specific type of patients, a specific type of patient for a specific outcome, right? We want to make sure that parent is well informed of when we anticipate seeing them, because there's a lot of doctor visits in the first year. And we also want them to have something to reference back so that they're aware of what the schedule is. Telehealth onboarding process. So this is another example. Maybe you want this type of smart message to go to new patients who have an appointment type of telehealth. And what we want to send is a request for all of our intake forms. So our consents, we want to get their insurance on file. We want to send them a smart messaging, smart message with some links to some forms we'd like them to fill out. We want to send that 4 days before their appointment if they've confirmed. We want it to go via text because we're going to give them some links. And this is going to be, again, in addition to normal reminders. So this is also an important one because if you're typically having to do this manually, call the person, request their information, send them to a website for consents, etc., then this is a huge efficiency tool for your office because now you've completely taken what was a manual process performed by someone on your staff and you've let technology be the added assist. Kind of going back to that, can this be your new hire, right? Can you alleviate some of this work, let smart messaging handle it for you and free up your staff to be more engaged in front-facing patient care, which we all know is so very important. And then, so 6-month newborn messaging. I want to go through this because I want you to see how this would work potentially with a, well baby first visit. So we're kind of going to go back to that first example and bear with me while we walk through this. Again, this is just an example, but I want you to kind of get the feel for it. So let's imagine parent comes in with new baby and it's their first visit, right? Again, that first visit after you're out of the hospital, come in, bring baby, let's make sure everything is fine. In this instance, we have a smart message set up for 7 days after that is tips on feeding your newborn. right? So are you having trouble with breastfeeding? Are you needing help with bottle feeding, formula versus what have you? Maybe it's getting them to a blog post that you think would be very helpful for new parents 7 days after their visit, right? Because now they're out of the they're out of that like first like crazy time, and now it's been a week and they have some questions. So this is good information to give to those patients. They value it. They're thankful for the information, and they know that if they need to get back in touch with you, they can respond to the smart message and start a conversation. That's also real key. Then maybe 2 weeks after, we're going to check in with parents, right? We're going to say, how are you doing? Maybe again, we're sending them a link to postpartum depression signals and signs, just to be sure that mental health of mom and dad or parents or what have you are good. So we want to check in with them 2 weeks after, and again, ask them if for whatever reason you need to talk to us or you want to reach out or you need support, text us right back and we'll get in touch with you, because smart messaging works in conjunction with the texting module that Doctible provides. So all of this messaging and conversation is all very fluid. Then we're going to jump ahead a little bit and we're going to talk about why crawling is important. So this is a blog post that we want them to go to. It's probably going to be on our website. So we want to get them back and engaging with our website. And we just want to give them some information about crawling, because developmentally, maybe this is where baby's at this point in time. And then in the chain, and we have the dotted line there to the 30 days, we have decided instead of a 30-day save the date prior to the next appointment, we want to have a 25 days before developmental questionnaire. Because as a new parent, I can remember being in my pediatrician's office and having to fill out a lot of paperwork with my baby and my carrier or my other child running around. And that was a little bit of like a stressful situation because I had a lot of paperwork to do. It's almost ready for my appointment, kids running around. I'm sure we can all relate to some of that. So if we want to send that questionnaire ahead of time, again, via a smart message, does that help alleviate both what we need to do in the practice and help the patient as well? Because again, we want it to be good for us and we want it to be good for the patients. And then that will roll in right into our regular cadence of reminders. So then we've got a 7-day pre-appointment, and then maybe a 5 days if they haven't engaged, a day before and an hour before. And that of course comes with driving directions. So it's a lot of time on this one slide, I know, but this is just to give you an idea of what your communication to your patients could look like when you implement reminders, smart messaging, really the whole bit in terms of giving your patients a way to talk back and forth with your office. And then I'm going to go through these quickly. This is just breaking down some of those messages, right? So 7 days after we've decided all patients that came in for that visit, we want to give them information on the feeding. We want to do this potentially 2 weeks post-appointment in addition to normal reminders, just to give you an idea of what that breakdown would look like. And so this slide is important. So for all of you that are on this webinar and maybe watching later, I want you to think through all of these components and what are you currently using, what could you maybe add to it, and where does smart messaging fit in for you. So I'm going to go briefly through these just to make sure you all understand the possibilities with the Doctible system. And again, being that it's completely integrated with NextGen, all of this works seamlessly together. So the heavy lifting is done, the integrations are there, it's all going to work for you as intended because we are partners together in this and we know our two systems can talk to each other. So first, reputation management. This is helping to maintain the practice's reputation online. So helping you to grow your Google star rating, helping you to attract new patients to your practice, while helping you gain private feedback that may be coming from patients who maybe aren't happy, right? Maybe they had a bad experience or there was a miscommunication. So we also want to drive home to you in a private way any feedback that might be helpful and relevant in you making some course corrections or doing some service recovery. So a very important module for retention and attainment of patients. And then patient communicator. So talked a little bit about that. That is the texting module. That's true two-way HIPAA compliant texting. The important piece of that is that it is working with all of our other modules. So hypothetically, we were talking about that ping to parents to say, how are you doing? Let's say someone is struggling and they write back and go, I do think maybe I'm having an issue and I would like some help. That message comes right to your office and your staff is able to engage back with a text or a phone call. There's nothing getting lost in like the abyss of the internet or the abyss of the texting world. That is something that's fluid and integrates and works with all the other modules. So it's a really big help there in terms of keeping the continuity. Web chat is a great functional tool for your website. It can be placed on any website, not just one that we're helping you create, because we also offer website solutions, which is listed there on the bottom. But it's a way to engage your patients when they come to your website, or your prospective patients for that matter. Gives them some frequently asked questions. You customize it and design it to glean the information you're looking for. And it also helps keep them on your website longer, which naturally will help you in organic search because your bounce rate hopefully is going down because people are engaging with your chatbot. Online scheduling. So this is the ability to request an appointment on your schedule. It's an elevation of like a contact us form and far more engaging for the patients that are on your site, or again, prospective patients on your site. Virtual waiting room. This is a workflow tool to screen for COVID. So again, I wish we didn't have the need for this, right? But I think that we do. And certainly as we get into the colder months, cold and flu season, the whole bit, again, you want to make sure that everybody coming through your door is healthy. And so this is a way to automate the process of screening for, health concerns that might be something where you'd warrant a reschedule of the appointment. Website solutions I talked about. So if you've got a website that you don't click through to and just go, wow, this is the best website I've ever seen. And if I was a prospective patient, I would want to come to this office. If you don't get that feeling, then we can help you create a fresh new website that might do better at helping to attract new patients to your office. So that's something that we can help with as well. Online intake forms, you saw in the telehealth example where intake forms were part of the cadence of messaging, and we wanted to get, in that example, the telehealth appointment patients, their digital forms to fill out prior to connecting with us. If you don't have your forms optimized digitally right now, if you're working with PDFs or paper forms, or you're just simply not happy with your forms provider, then we can also bundle that service in as well. Smart messaging, I think we all know what that is because we've talked about that. And then patient reminders, we touched on that a bit. So smart messaging is meant to work with reminders, right? So we want to give the patients all this great information and we want to give them value add and the whole bit, but we also want to make sure that they get to the appointment on time and with the right expectations of when they're going to be seen and where they should go. So that is what patient reminders is for, helping to reduce your no-shows and automate those confirmations through the platform. Keep in mind that write back happens with this activity. So if someone confirms through the Doctible system, it is pushed back into your NextGen EHR. So you have that work flow through automatically. So again, reducing the amount of tasks that your staff has to do on any given day. And so this is just, again, an example of what this would look like, back to that smart messaging piece, so well baby visit, etc. We've kind of already talked about this a bit. And now we're at the part where we're at the Q&A, so right at the half-an-hour mark. So there are several of you on the call, or excuse me, on the webinar. So should you have questions, now is a really good time to ask them. I will do my best to answer, and Chris will help me out as well.
So we'll give everyone just a couple minutes to gather their thoughts and get the questions put in. There were a couple in the meantime
Okay.
that we were able to answer in chat. One that came in was that they're currently on DocuSign, and would this replace DocuSign?
So there's a possible module with forms that could replace a DocuSign product. Smart messaging in and of itself would not, but we have a package that would help you remove DocuSign from the process and then bundle your functionality here.
And that's something that you could talk to your sales rep or client services about as well.
Right. Yeah, great question.
Kelly, is there one question is there an integration time frame? What typically is the implementation time from start to finish?
Yeah, that's a good question. So usually when we're looking at onboarding new clients to services, I will say this, if you're already using Doctible in some capacity, adding smart messages are going to be a very simple process. The lifting on your end for smart messaging, as you can imagine, is letting us know from like a consultation standpoint, what are the smart messages you want to build, going through that who, what, when, where, why. So that's where the time frame comes in with that. If you have not ever worked with us before, then usually we would say 2 weeks is the total time from like, hey, we're ready to go. We've decided on a package and we're ready to move forward, to the time where your staff feels very comfortable with the technology and you're off and running. Could be faster, could be a little longer if, for example, we're building you a brand new website, but typically between 1 and 2 weeks.
And then the forms that are filled out and sent from the patient, once they complete that, where do those forms go? Do they go into the patient's chart or queue, or where do those end up?
That's a good question. So they would live external of the NextGen system. So they would not be quote unquote integrated forms, at least not at this point in time. I know there's the hope that maybe at some point we will have that, but right now those forms are not integrated. So you would have that information external, but in a way that you could, drag and drop some fields, or copy and paste what you need, or add the completed digital form to the patient's record inside of NextGen.
And I think a good reminder, this is HIPAA compliant, right? So there's
Yes.
no
Yes.
issues there. Yeah,
Correct. Yes.
perfect. And I'm gonna go out on a limb. Oh, we got one more.
Okay.
What are additional costs? I would defer that to your sales rep or client services with NextGen to talk about, what the cost is for and what you need. It's going to vary based on how much you're needing implemented. So I would just
Correct.
defer you to speak with our client services representative.
Yeah, the
Yeah.
next logical step, just for clarity there too, the next logical step for any of you going, oh, this is good, I'd like to explore it further, would be to get in touch with your rep and go through a little bit deeper dive personal consult, where they're going through and talking to you about the use cases and what you need it for, and maybe some other add-ons that may complement, and then you'll go ahead and get the price as soon as you've gone through that process. Should be quick though.
And if it would help in the follow-up email that you get with the webinar recording, I'm happy to send out a piece of information on who specifically you could talk to at NextGen to get more information on this, or to set up a time to talk. If you just put in the chat or comments, just a yes, then I'll know who it is, and I can make sure that I include you or have someone reach out to you. And if there are no more questions, it looks like we might have come to a stop. Thank you very much, Kelly. This was incredibly informative and eye-opening as to what's possible with messaging right now, and healthcare in our field. So I want to thank you, and thank you to everyone for attending. Without what you guys do out there in the field, you do make the world a better place. So thanks. But thanks again, Kelly, for everything. We really appreciate it.
Absolutely, it was my pleasure, and we look forward to talking to a lot of you soon. And happy holidays early for those of you who spent time with us today.
Thanks, everybody. Have a good day.